Hi there, my name is Amanda Harbrow-Harris and I am the current hygienist of the year. I'm here to chat today with Pat Popat, who is a dental therapist and a multiple practice owner.
Amanda, tell me, how did you get into being a dental hygienist and, leading to being a two-time hygienist of the year?
Well, it's actually quite a long story, so I will summarise it. I started off as a dental nurse and I did this for years, did it to a death. I worked in Dubai, Harley Street, general practice, private practice, and I just wanted more. Unfortunately, I left school with no GCSEs, so I had to gain these qualifications. I then did Exploring Science Open University, first year of a degree, to then get onto the degree course at the University of Essex to become a hygienist. All of this took me about 3 years before I even started uni. I then did uni, smashed it with a distinction, and I've been working as a hygienist now, qualified 10 years ago, and love it.
So we've got a similar pathway because I also started out as a dental nurse and ended up working in a specialist periodontal referral practice under a periodontist and kind of grew from there. So I was dental nursing and I was kind of a bit of an odd man, really. I was fixing chairs and fixing things that weren't working, then worked chair side, and then worked my way up to being a practice manager, and then felt that I wanted to go back to being clinical. So I ended up, doing my dental nurse qualification, taught dental nurses, examined for the examining board for dental nurses, and then went back into being a clinician. So that's when I joined University of Essex and did my hygiene degree, and that led on to more things with lecturing, locally, internationally, and doing lots of other things, and then do my therapy degree. So yeah, and then we've met each other.
Well, yeah, I was about to say, I've known you for a long time. Like, we've worked out, we've known each other probably for about 17 years. So I was actually a dental nurse working on the clinic when you were doing your training.
Yeah.
And I can remember watching you train and being so jealous because I was desperate to do the course.
And well, here you are.
Yeah.
Right? So you're now, so involved, and, from someone who saw where you've come from as a dental nurse and know your background from where you've come from, I'm quite proud to see where you've come from and the hard work that you've put in to getting to where you've got to,
Likewise as well. I mean, you with your practices, that's amazing. You're smashing it.
Lots of sleepless nights, but we're getting there. Right. And now we're both involved with NSK on the Ikigai panel, and we get to do a lot of work together, which is nice.
Yeah, and being a clinical educator is great. I've met lots of amazing people, learned a lot from them. And also as well, I've been a clinical educator for the University of Essex, so it's been great training other hygienists potential therapists on how to do our job as well.
Absolutely. As you saw today, we had a couple of the students from the University of Essex in-house.
Yeah.
So it's nice because we can talk to them about the various products that we use and, the differences in, different ultrasonic systems, powder therapy, and just, like you said, training them on how to work the way we do.
Yeah, exactly. Like little tidbits, like put the wire over your arm so you don't get RSI when down the line, or how to sit properly, what equipment works well, what tip works best for this type of patient.
Yeah. Amazing.
It's great to be able to share the knowledge.
Exactly. So Amanda, tell me, what are the changes you've seen with dental hygienists and even some of your therapist colleagues over the time you've been in the career?
Well, as I was at university training, so back in 2013, direct access came in, which has been pivotal for our career. Just realising that we're not just auxiliary staff, and actually we are part of a multidisciplinary team of people that help with prevention and cure. So hygienists and therapists are not just people that plod along in the background helping the dentist out. Like, patients need to see us for prevention, for hygiene treatment. It has health benefits, it helps prevent heart disease and strokes, diabetes, arthritis, Alzheimer's, cancer, the lot. Menopause symptoms, helps people trying for a baby.
Erectile dysfunction.
Erectile
It's all in there.
Lovely.
So you know, I think now patients are more aware of, you know, a bit like America, patients are finding out that they can go to a hygienist direct access without the need of seeing a dentist, and also at the same time, you know, taking more care of themselves. I think our job or our role has become pivotal, as you quite rightly said, in making sure that we are saying to patients, you know, this is linked to your heart, this is linked to your, you know, body, and sharing that systemic, you know, knowledge that we have. And I think it's really changed the way people think and perceive us. And also in the industry with dentists, like you said, that we're not just auxiliary staff, it's not just going to see them for a scale and polish. We are carrying out non-surgical periodontal therapy. You know, our scope has grown.
Yeah, and there's other things we do as well, like if someone can't afford to see a periodontist, or it's not complex enough to need to, you know, out of my remit to refer on, we don't just do scale and polish and make you look pretty. It's about preserving the bone and the gum in your mouth.
And I think dentists are now appreciating the role of a hygienist, the role of a therapist, and how much, you know, you're starting to see that shift from, you know, last 10 years, I would say, you know, that actually they're not taking our patients and doing the job, you know, actually working in a multidisciplinary way. Everybody is important to just getting that patient to where we want on their journey.
And also our training is more specialised in that aspect, whereas like obviously dentists learn how to do a, you know, hygiene treatment. It's not the 2 years in depth that we've been doing it at. So, you know, this is our sort of remit.
Absolutely. Yeah, great stuff.
We're not just glorified beauticians.
So one of the things I think, you know, is that what we are doing is actually life-changing. And I think, you know, where we are able to see a patient who comes in either direct access or is referred to us from the beginning, and we're able to help them the whole way through a journey from, you know, explaining what's going on in their mouth and then taking them through the journey to help them actually, you know, resolve any periodontal disease that they may have, or just getting them to clean better and just, you know, helping them to understand how to look after their mouth and their body essentially.
Yeah, I mean, I agree. I mean, I've worked at my practice that I'm at now for 9 years and built up quite a rapport with patients. You know, some patients I see every 3 months, some every 6, once a year. And it's not just about the treatment either, it's about the rapport you have with patients and the relationship you have with them. Like when I was getting married, they all knew I was getting married, you know, when they're getting married and when they've had grandchildren. And it's not just about doing the treatment, you know, it's the whole picture. And also as well, like you get direct access patients. Some of them are really nervous. You have tears at the beginning of the appointment and then hugs at the end, which I love. And I know that's always a satisfying appointment. And yeah, just helping them on their journey to better oral health.
I won the award for treatment of a best nervous patient.
Oh, well done.
And that's something that I kind of pride myself in working with nervous patients, because, you know, they might not have come to the dentist or seen a hygienist before, or, you know, they've just had trauma in the past. So to help them overcome that fear and build that trust where they won't go and see anybody else. And one thing, and you've heard me say this before, is I treat every patient as though they're a member of my family.
Yeah. And I don't think people who aren't in dentistry understand actually how personal your relationship is with patients. Like some people are like, well, that's none of their business. But honestly, I genuinely care about them and I feel it's reciprocated.
Absolutely. And, you know, knowing when that they've gone on holiday, where did they go? They come back in, and, oh, how was your trip to so-and-so? And you just, the whole, you know, oh wow, you remembered that I went on holiday, and they're so happy and they share so much with you. And then as part of treatment, you get much more out of them.
And they trust you as well, which is quite humbling. And it's, you know, they're in a vulnerable position, they're laid back, they might have had a horrible childhood experience. You know, it's very humbling that people trust me.
Yeah, absolutely.
And I don't want to abuse that position.
No, absolutely.
So Pat, we're both involved in NSK and Ikigai. How did you get started with them?
So I got a phone call from Siobhan Kelleher, who was telling me, you know, about this development and this amazing partnership that she was going to set up with Ikigai and the NSK team, and how it was going to be a sort of collaboration of hygienists and therapists working together, and I saw the list of amazing clinicians she was bringing to the table, and I thought it's a no-brainer. I'm definitely in. And it's become like a little family. Look at us, you know, after all these years, we're working so closely on just providing educational material for other hygienists and therapists, and also, you know, bouncing ideas off of each other to help the profession grow and develop.
Yeah, I mean, same. Siobhan Kelleher also approached me about the same time, I think, as you, and I saw the list of clinicians, saw your name on there, thought, well, Pat's in, so am I. And also, like, all the other credible hygienists and therapists, you know, like, there's some big names on there, and it's been amazing, actually, and for me, it's been career changing. I've learnt so much, and, you know, as you said, we bounce ideas off of each other, and they provide amazing free courses, webinars, and for hygienists and therapists, and it's non-judgmental, you know, no questions too silly.
The NSK HQ team, if you like, you know, are so supportive of what the Ikigai program is trying to deliver, and, you know, it's encompassing so much to help everybody just become the best they can be, you know, as a clinician. And like you said about it being life-changing, you know, if you look at some of the team of educators, it has changed what they're doing, and they're delivering their own courses and growing and flourishing, you know, in so many incredible ways.
Also, as well, the equipment is all, you know, led towards hygienists and therapists, so it's good that a company that produces such excellent equipment then supports the clinicians that use it. They don't just put it out there and leave you to it.
And I think, you know, talking to some of the sort of, I suppose, clinicians that want to try the NSK products, they can loan a kit, you know, try it themselves and experience how good the product is before they commit to buying it. And that's something that I know a lot of people have done, you know, and they've actually then gone, yeah, I like this, I'm using it. And I've been using, you know, a lot of the equipment for many, many years.
So I use the Varios 970 piezo. The reason being is I work at 2 different practices, so it's easy to move between surgeries, and also as well, if I need to go downstairs and see a patient, it's easy to just transport, and it's amazing. It's brilliant. Comes with a massive wide variety of tips, so I tailor them to each patient. And also as well, I used a powder therapy machine, so I've got the PerioMate and the ProfiMate Neo. And again, they're portable, so they just clip onto the fast handpiece attachment of the unit. What do you use? The
ProfiMate Neo and the PerioMate, they were kind of staples, you know, as part of the treatment we were offering. And then we got, when I first started, the practice had the 970, and that was, you know, again, a brilliant piece of equipment. As I've worked at other practices, we've got the Combi Pro, and the Combi Pro is brilliant because everything's all in one. And you know what, it speeds up treatment, delivers results, and, you know, you can interchange between the Perio handpiece or putting the Profi handpiece on, and you can tailor it, as you said, you know, using the huge array of tips that you've got. So Amanda, tell me, we're talking about tips, what's your favourites?
I've got about 3 favourites. I really like the G8 tip, the G16 and the P1 diamond. The reason I like the G8 tip, it's a good general all-rounder for supragingival scaling. The G16 is great for tighter contacts and subgingival scaling. And the P1 diamond is great for perio, with the diamond tip just having a slightly rougher surface, just to remove those tenacious subcalculus deposits.
Yeah, so we're not too far off really, and yeah, I'm a massive fan of like the G4, to be fair. Again, a good all-rounder tip, and the P1 diamond is a good tip. So I think you start, every clinician finds their own favourite, and starts, you know, utilising them. And obviously we've got left and right curve tips now, so that also makes a big difference when you try to access vocations.
100%, and when you're doing perio as well, so the P20 left and right, I have my little kit set up, and I do my P1, then I do my left, then I do my right, then I do my hand scaling, and I come back in with the vocation scaler, and it's just great to have not just one tip for the whole job.
Yeah,
you need to be able to access the neck and the different angles.
and it's so quick to interchange your tips.
Yeah.
You know, they screw on and screw off so quickly, so it's not like you're wasting time, you know, fiddling about. You know what's there, boom, boom, boom.
Yeah. And I can do, you know, I know how my appointment's going to run, what stage I'm at what time, and yeah. And as you were saying before with the powder therapy, it's quick to change.
Mm-hmm.
You've got the Combi Pro, I've got the one that clips onto the unit, but you literally just click it on, click it off.
That's it.
Job done.
Brilliant. You won Dental Hygienist of the Year twice. Tell me, what is your favourite treatment, or you know, that you provide to patients?
Well, I like to work very much with minimally invasive prevention treatment.
Mm-hmm.
So a normal appointment would run as obviously assessing them, asking all the questions, looking, etc., extra-oral, intra-oral. But starting with the treatment, I would quite more often than not use the Profimate Neo to remove any stains and loose biofilm.
Mm-hmm.
I would then come in with my Varios 970 favourite tip, or what actually I would tailor what tip they need. I have a vast selection, and remove the calculus and the remaining biofilm and stains. I would then hand scale. I would then come back in, maybe give them another powder therapy to finish, just to remove any remaining deposits. It's all minimally invasive. You won best treatment of nervous patient. How would you roll an appointment out?
For me, I actually won it, you know, working as part of my award. It was talking about a child that I treated, and for me, whether I'm treating children or adults, I think an appointment with me is usually obviously doing your history, is doing your charting, and then a love for me is doing the periodontal therapy, and that, you know, has grown for me. I grew up under a specialist periodontist, and that's where I found my love, you know, of seeing a patient from start to finish through periodontal treatment. And you know, we all have our limits, I suppose, and you know, I've advanced to do my advanced certificate in periodontal treatments and use lasers as well. So from that point of view, you know, I just try and offer the patients as much as possible to make sure that they get the treatment they need.
So Pat, how do you see hygiene and therapy scope expanding and hopes for the future?
I think for us as clinicians, and starting to now be clinicians in our own right, as we were saying earlier, you know, prescribing rights are the next thing that we really want to bring on board, and have more autonomy over, you know, doing. There may be advanced courses or qualifications that we can do to understand pharmacology on a different level, and being able to actually prescribe, you know, medicaments to patients or adjuncts that we might, you know, see patients benefit from.
I mean, at the minute we can prescribe fluoride, high fluoride toothpaste to patients, but we can't write the prescription.
Mm-hmm.
I mean, that would be much more helpful. So at the minute you get 3 tubes of high fluoride toothpaste on prescription for the same price that the patient would buy one from behind the counter.
Mm-hmm.
I feel that's a bit mean to make them go and pay that.
We want to be able to deliver the best care to patients at a decent cost, I suppose. And you know, we're in hard times financially for a lot of people. You know, we can offer treatment with,
It's a fabulous
you know,
service.
to people that can't necessarily afford it.
Mm-hmm.
And hopefully this next batch of clinicians that are coming through will be able to, you know, prescribe in the future. So there's so much being done with the British Society of Dental Therapists and the British Association of Dental Therapists, so working together to try and work on those prescribing rights for us, you know, and so much has advanced already with the hard work that they've been doing.
So Pat, what advice would you give young Pat?
I would say to myself, the sky's the limit. The harder you work, the more you're going to achieve, and make sure you surround yourself with good clinicians, supportive groups. Like Ikigai has been phenomenal. You know, as we said earlier, we've bounced off each other and supported each other so much, And I remember making the announcement in our WhatsApp chat, that I've bought the practices, and everybody was so proud. There was no jealousy, and even now when I'm meeting other members of the NSK team, there's NSK autoclaves here now,
Sure.
and it's all about, everybody's there to support you, wants you to grow, wants you to be the best you can, whether you're a clinician or a business owner. And I think I would just say to myself, you know what, just sky's the limit, go for it. Work hard, and don't be afraid to step outside of the norm, if you like, and you can achieve what you want. What about you?
Me? Well, you're right, the sky's the limit. You can do as much or as little as you like. There's nothing wrong with just doing your job and going home. People have other commitments, families, and for me it's my passion, which is why I'm hygienist of the year. I've worked my backside off for it, and have decent equipment. That is the one piece of advice I would say to anyone. I mean, as I've already said, I've got NSK equipment and it's fantastic. It makes my job so much easier. It's more comfortable for the patient because it's easier. Make sure that you're always regularly checking your tips to check they're not worn. Again, that's for patient comfort and clinician comfort as well. And advocate your profession. You're always learning, bounce off of other people, as you said. And yeah, we are proud of you for opening your own practice. It's amazing. There's plenty of room in the ocean for us all to swim. Why would anyone be jealous?